Hi, everybody. Welcome. This is Leslyn Keith. I am the Director of Research and President of the Board for Lipedema Project. And I get together with you twice a month, usually on the first and third Thursday, to talk about different research updates that have relevance to lipedema. And so today I have a really interesting paper to talk to you about, but I have to tell you, this paper is really stretching my abilities. And so I've tried to summarize as much as I could understand about it, but realize that I do not have a complete understanding of it. But I think this might be really important to have help us figure out what's going on with lipedema. Why does it get triggered? Why does it get worse? And so you can see the title of the paper there. It's called, Is the Endotoxin Complement Cascade the Major Driver in Lipedema? And this was written by two researchers, Dr. Kublikov in Germany and Dr. Scherer in the USA. They got together and they wrote up this, actually, it's an opinion piece. So they were looking at the literature and coming to some conclusions, and they have some pretty interesting ideas that, of course, are going to need a lot of further research to prove this out. But it's a wonderful, thought-provoking article, and at times very difficult to understand. So I'm going to do my best to help you with it. And basically, I'm going to have to give you a couple of definitions because there's just things in the title that I didn't even know what those things meant. And so we'll talk about that. But basically what it's talking about is a potential pathway for chronic low-grade inflammation, why it occurs in lipedema, why it would contribute to the resistance of fat loss in lipedema, and why it would actually promote further fat growth or further expansion in lipedema. So let's look at first, what is their hypothesis? They are proposing that there's an underlying cause of lipedema may be the accumulation of bacterial lipopolysaccharides, and these are called LPS. And so if you do read this article, you're going to see LPS all over it. It's a certain kind of bacteria, lipopolysaccharides. And the presence of this LPS in the lower body fat, that together with a malfunctioning immune system, can actually induce low-grade inflammation and uncontrollable fat tissue growth. So let's look at a couple definitions to help us understand this paper a little bit more. So first, let's look at that bacterial lipopolysaccharides, or LPS. These are also known as endotoxins, and you saw that in the title of the paper is the endotoxin complement cascade. And so that bacteria is known as endotoxins, and these are toxins that exist inside bacteria. So it's inside the bacterial cell. And then when the bacteria dies, all of this is released into the tissues. So these are toxins that are released into the tissues by that dying bacteria. And so, and interestingly, that this release, if you get enough of a release, it can give you a condition called metabolic endotoxemia, a particular type of infection. And so it gets, when that material leaks into the surrounding tissue, you can get this condition. And actually, if you have metabolic endotoxemia, it can lead to a variety of chronic conditions, from heart disease to autoimmunity to anxiety and insomnia and depression. And according to these authors, maybe it also leads to lipedema. It also is a factor in insulin resistance and diabetes and weight gain, and potentially a resistance to weight loss, all things that we see in lipedema. And unfortunately, this endotoxin, this LPS, can leak into the bloodstream from the gut into the bloodstream if you have leaky gut. So all these things kind of work together to make a perfect storm, and maybe it can be implicated in triggering or exacerbating lipedema symptoms. Okay, there was another part to that title that we got to define, and that was the complement It was an endotoxin complement cascade. And so there is something called the complement system. This is actually part of your immune system. And so when I looked this up, it said a vital part of our immune system is the complement system. It's a group of proteins in the blood that work with the immune system to protect the body from infections and to remove dead cells. And these particular group of proteins are usually inactive, they're dormant, except when they're activated by particular pathogens or antibodies. And so when they're activated, they work together with the antibodies to attack that particular pathogen. And so what if your complement system is impaired? And they talk about how they think it might be impaired in lipedema. So let's look at some of these things that they're bringing together. And one is lipedema and pregnancy. So one thing that we know is that there's this times in a woman's life where it seems that lipedema is associated with those times as being triggered or worsening at those times. And one of those times is pregnancy. But they also, these authors are hypothesizing that lipedema acts as a pseudo pregnancy. So it acts like the body is pregnant, but when it's not. And so because they feel like lipedema has a lot of things that mimic pregnancy. So in other words, the fat that is stored, or the increased fat stored on the hips and the butt, this is something that women do naturally, because when pregnant, this is going to be a good energy storage for the growing fetus and also for energy for the mother. And then, so this proliferates, that fat in those areas proliferates during pregnancy and also during lactation when you're breastfeeding. And this fat in those areas of the body are resistant to being broken down and burning that fat. It stays. You can diet, as we see with lipedema. When we use a low calorie, low fat diet, we lose fat everywhere else, but not in the areas where you have lipedema. So on the hips and butt especially. And that is the same as it is with someone who's pregnant. And then there is a low grade inflammation in that expanding fat, in that growing fat, and that it might be because of an increased proliferation of this LPS, these endotoxins, that and also there is higher intestinal permeability sometimes when you have leaky gut, but also it turns out that a lot of women who during pregnancy have an increased intestinal permeability, meaning stuff can leak out of the intestines more than usual. So you have a lot of these things coming together, a lot of similarities with pregnancy, even though the woman is not pregnant. Also, this intestinal permeability could be linked to higher estrogen levels that we have during certain phases of pregnancy. And it's often also higher estrogen levels, or at least higher than the progesterone, seems to be also a characteristic of lipedema. So just that those higher estrogen levels can also impair the tight junctions that are normally tight junctions in the intestine, and it's allowing it to be leakier. So that kind of comes together and also mimics pregnancy. A lot of interesting stuff in there that I wasn't aware of. And now let's look at how inflammation can cause changes in fat tissue. So the authors point out that obesity, lipedema, and a condition called lipohypertrophy, meaning that we just have a proliferation of fat tissue, but we don't have the other symptoms that typically go along with lipedema. So all three of those conditions are actually characterized by a chronic low-grade inflammation in the affected areas of the body. And to have this state of low-grade inflammation is it all has similar cytokine or stuff that's emitted from adipocyte or fat cells. It's very similar in all three of those conditions, and it's going to cause some kind of immune response. But if you have this impaired, what they're saying, not just immune system, but impaired of the complement system. So this specialized group of proteins that helps the immune system, if that is compromised, then we're not going to be able to respond to that chronic low-grade infection as we should. So all of this induces a state of that condition called that metabolic endotoxemia. So you have even higher concentration of the LPS, those endotoxins in the tissue, and it's inflamed, and it actually is expanding, it's causing fat growth. And now it's all worsened with the intestinal permeability or the leaky gut. So they are saying that this might just be one of the main drivers for lipedema starting and possibly also getting worse at certain periods of the woman's life. So another reason that they thought that this might be the mechanism is that they looked at what is the role of these endotoxins, this LPS, in various comorbidities. They seem to be fairly common with people who have lipedema. There's a higher incidence of these comorbidities. And they looked at morbid obesity, hypothyroidism, allergies and asthma, and PCOS and lymphedema. And interestingly, every one of these has a higher load, a higher burden of LPS in those comorbidities. And so you put that with lipedema. And so another reason why they think that this, the LPS or those endotoxins and an impaired complement system might be what's happening with lipedema. So let's look at morbid obesity first. So in general, so someone who has morbid obesity usually has significantly elevated LPS levels in their blood. And there is, especially at the later stages of lipedema, we typically have a pretty high incidence of morbid obesity. And so now you've got the elevated LPS because of the obesity, and you also have a little bit with the lipedema. Now you have a pretty high burden of these endotoxins. So it means that you're going to have a large load of those endotoxins. Hypothyroidism, very common comorbidity. It seems that women with lipedema have, it's around 31% have hypothyroidism or low thyroid. And the general population is generally about 5%. So a lot higher incidence in lipedema. And there has been noted, at least in Hashimoto's thyroiditis, there are elevated levels of LPS associated with that particular thyroid condition. They did not say in this paper if hypothyroidism also has that increased load, but this could be, if it does, that would also contribute to that endotoxin load. And then allergies or asthma especially. There seems to be an increased incidence of asthma or allergies with lipedema. And it said, let's see, about 18% of patients with lipedema in some papers, it's being reported that they have asthma, and that the general population, it ranges anywhere from 3 to 9%. So you can say at least twice as often it's showing up in lipedema. And one thing that happens with asthma and allergies is that we have an increased intestinal permeability. So you have stuff leaking out of the gut more often. So that, again, could be increasing that endotoxin burden on someone with lipedema. And then PCOS, this is polycystic ovary syndrome. And there is a known increase of concentrations of LPS in the blood, and I think also stored in the fat tissue of people who have PCOS. And this one's a little bit trickier. It's a little bit looser of a connection because the authors state that there's a little bit of difficulty in agreement and definitions of what constitutes PCOS. And so then you have different levels of incidence in the population. But they think that it's been reported about 3 to 6% of people with lipedema have PCOS. But in the general population, it's anywhere from 6 to 20%. So again, we have that variability in how people are defining PCOS. And so we have the difference in how often it's seen. And so kind of similar to just how it is when we're trying to define lipedema. If everybody defines it differently, then the incidence in the population is going to be, of course, different. And finally, lymphedema. And there is various indications that people with lymphedema have this increased load of endotoxins, and it seems to have a connection to endotoxemia that we talked about earlier. And so namely, there's some negative reaction of the lymphatic endothelial cells, and those are the cells that form the lymphatic vessels. Those are specialized cells that make those tubes, those vessels that are carrying your lymphatic fluid. And so those cells react badly to the LPS. And so elevated LPS can cause the lymphatic cells to release various pro-inflammatory cytokines that will increase inflammation. And we know lymphedema is an inflammatory condition. And so then it can make those vessels more leaky. Well, it's hard to carry fluid away from a swollen area if they're leaking. So so if you also have a comorbidity of lymphedema along with your lipedema, then you can see how you might have this increased load of those endotoxins, of that LPS. A lot of interesting stuff there, but wait, there's more. So then they went on to talk about what's the role of an impaired complement system. Remember that group of proteins is trying to help out your immune system to get rid of these pathogens. If it's impaired, how does that change your adipose tissue, your fat tissue? What happens? And so what the authors are saying is that white adipose tissue is very much just a storage for energy. It's not metabolically active like brown adipose tissue. So it is, and that's the kind of fat tissue that is your subcutaneous fat, the fat that's just right underneath your skin. That's where we usually see most of the fat growth and fat expansion in lipedema. It's in that white adipose tissue. And they're saying that if you have expansion in that fat tissue, it seems to have a negative impact on the complement system, those proteins that are trying to help you out. And so now, just because your fat tissue has expanded, you have an impaired immune response, basically. And it's likely also those pathogens and that LPS tends to be stored in that white adipose tissue. That might very well be also that your lipedema fat. So it's storing those pathogens. It's storing that stuff. And it also happens to be a place where we store a lot of hormones. And it also happens to be a place where we actually emit hormones. And one of the hormones that your fat tissue sends out is adiponectin. And this is a really important hormone to your lymphatic system. It actually helps those lymphatic vessels be less leaky. So we want to have the appropriate levels of adiponectin circulating in our body. And it also, not only that, adiponectin helps reduce inflammation, so it's anti-inflammatory. It also helps us to be more insulin sensitive. So when we send out insulin, our body responds appropriate to that insulin, and we're functioning in a much more healthy, metabolic, healthy way. So adiponectin is very important in that whole process. And so if you happen to have an acute attack of endotoxins, so just they get sent out, and so adiponectin will respond to that very quickly and help out that complement system, help out your immune system to deal with those endotoxins. But it turns out that if you have a very low grade inflammation, a low-grade amount of endotoxins, but chronically always going out, you actually have less adiponectin that's going out. So it's inadequate to help you deal with that, that situation. So now we have an impaired complement system. We're not sending out enough adiponectin, which is making our lymphatic vessels leakier. It's letting the inflammation get out of control because adiponectin helps with that inflammation. So now you've just got this chronic activation of those low levels of that LPS. And so you can see how this cascades into something that might be really driving our lipedema, according to these authors. And they said there's genetics that come into it as well. We know that they've done a lot of research on genes and trying to find, what is the lipedema gene. Most researchers have come to the conclusion that it's probably not a single gene, it's a group of genes. And what they're seeing in the genes that have been identified that might be responsible for lipedema, these are also genes that not only can they produce lipedema, but they also can impair that specialized complement system. And so it reduces the ability of your fat tissue to counteract that inflammation. But on the same time, how interesting, it actually promotes fat expansion. So we've got a lot of things biochemically that seems like it is inducing or triggering lipedema and making it worse. So very interesting paper. I have put the link down below for you if you would like to read the paper. Unfortunately, that link, it's just going to give you an abstract. Please email me if you would like a copy of this whole paper. To read the full text, you're going to have to, it takes a little bit of studying. I know we got people out there that are biochemists and such that are going to understand this better than me. So check it out. If you'd like to read the full text, just email Leslyn@lipedemaproject.org and I will send that to you. Found that very interesting. We're trying to figure out what's the role that hormones play, that genes play, that and now what do endotoxins play in lipedema. So very interesting paper. Just checking what you have posted here. Thank you for being here and posting and letting me know you're here listening. I see Nancy is here from chilly Mount Pleasant, Michigan, overcast and 42. Yes, and he says, Truth Seeker says, my mom took antibiotics while pregnant with me, which I was, and then you were born with thrush. Yeah, and that's an opportunistic infection that happens once your good bacteria has been killed off by the antibiotics. I know this affected my immune system and caused my mom to have 2 miscarriages. Yeah. So that's involved somewhere in there. So thank you for pointing that out. And then Truth Seeker goes on to say this antibiotic was taken off the market in the early 70s. It was in that same family as Cipro. And for those of you who don't know, Cipro is a very caustic antibiotic and has been implicated in unprovoked, out of the blue, tendon tears. Specifically, what they've noticed a lot is particularly if an athlete is taking this antibiotic, all of a sudden their Achilles tendon snaps. But I've had other patients that were, for instance, taking Cipro for recurrent UTIs. So they were on lots of doses. One time usually won't do it, but lots of times taking Cipro. And then you can get these tendon tears and you're not even doing a lot of physical activity. So be aware of Cipro. And Melinda says, all this resonates with me. I gained all of my weight during my 3rd pregnancy. Yeah, there's something happening there. And I think this paper is an excellent start for us to learn about this. They specifically said that, this endotoxemia, this metabolic endotoxemia, the way we treat it is usually through antibiotics, but we also know that treating leaky gut is we're trying to replenish that flora. See your medical provider if you suspect you have leaky gut, because healing that may be a key to you being able to manage endotoxemia, and maybe you won't have to do it with antibiotics. It's unfortunate that people with lymphedema and lipedema quite often find themselves on antibiotics. Especially lymphedema, it lends itself to infection, and you just seem more prone to it. And so sometimes it's better to hit it really with a strong antibiotic, hopefully not Cipro, but a very strong antibiotic for a short time, rather than maintaining an antibiotic at a low-grade level over a long time. We're trying to deal with something that's chronic, and maybe chronic taking of antibiotics may not be the answer. But talk to your healthcare provider and say, this is another thing that might be contributing to my lipedema, and maybe there can be help for that. And yes, a Truth Seeker says affects the connective tissue. And we know that there is a connective tissue component to lipedema as well. And started popping tendons, Melinda says, yes. So you can see how all this comes together. It's very interesting. And I just feel like we're at the cusp of really figuring things out. And remember that you who are experiencing these symptoms have a lot to contribute to helping us figure this out. My mother was, Amy says, 98 pounds when she got pregnant, and was over 250 after her third pregnancy over 5 years. And I wish I knew she had lipedema then. Yes. Yeah. And it just seems to be a very common triggering period, not as often as puberty, but definitely we see it also happening with pregnancy. And Melinda says the frustrating thing is that most MDs have no idea what I'm talking about, right? So check out our provider directory. It is by you contributing to it and you seeing these medical providers. We put together a directory at lipedemaproject.org, and it is a map of the world, and it has throughout the world different providers who know something about lipedema. And so check that out, and maybe you'll have someone in your area, and maybe you have someone that is not on the directory. So contact us, because this is how we're always updating and improving on that directory, is by your input, because you're the ones that are out there going to see these people. Before we go, I wanted just to let you know about something that's coming up. We have a free webinar that's going to be coming up on December 14th. Lipedema 101, understanding the basics. So if you are new to this diagnosis, or you feel like you just need to return to the basics, this is a webinar for you. It's going to be at 3 p.m. Eastern on December 14. The link will be below. It is free. Be sure you register, because even if you are not available at that time, if you register, you will get access to the replay, and so you can watch it at your leisure. So that's going to be it for now. Thank you so much for joining me today. And I look forward to seeing you again next month for more research updates. Bye-bye, everybody.